Next up is John Feeney. He's the CEO of the College of Contemporary Health, who've been very kindly our sponsors for this huge event.
So thank you for the kind introduction, and we are really delighted to be able to attend this important annual symposium of the National Obesity Forum. My name is John Feeney, and I'm the CEO of the College of Contemporary Health, which is a new educational institution focused on creating graduate interdisciplinary educational programs for healthcare professionals who need to acquire the necessary tools to deal with the debilitating effects of modern lifestyle diseases such as obesity. I'm sure all of you are aware that in terms of the overall cost to the NHS and the overall UK economy, the numbers are regularly reported, as per the slide, about £20 billion a year. However, if you look at what's happening in other countries, our research leads us to conclude that these numbers are underreported. In Australia a few years ago, which has approximately 35% of the UK population, the aggregate cost to the Australian economy, not even adjusted for purchasing power parity, was $39 billion a year, pounds, sorry. So when we adjust it for population, we estimate that the aggregate cost of obesity to the total UK economy and the NHS is actually closer to £100 billion. The medical profession has taken up their part of the challenge with a number of important initiatives in recent years, such as the Foresight Royal College of Physicians studies in 2007 and 10, the various NICE studies, Obesity in the UK, a psychological perspective, and Action on Obesity in January this year by the Royal College of Physicians. There are many other reports, but one thing is clear from all of these studies is the need for significant numbers of additional trained personnel to ensure that healthcare workers gain a broader and deeper understanding of the complexity of obesity and its causes. In the clinic itself, many of the healthcare professionals have acknowledged that an army of obesity care trained staff are needed. This is one of many articles that have been published over recent years. Currently, many of the universities have programs in various aspects of weight management at the certificate, diploma, and master's degree level. Unfortunately, all of these programs enroll students once and occasionally twice per year and require attendance. Not surprisingly, such scheduling makes it very difficult for busy professionals to get the time off to attend, and thus the number who are trained annually is relatively low. We established the College of Contemporary Health earlier this year to create postgraduate certificate and diploma courses in obesity care with a curriculum directly mapped from the major documents by the various medical royal colleges and other learned societies. The courses will be delivered by an advanced online learning platform that will be unique in the UK. The platform will have advanced features such as social media tools along with strong and relevant curricula to make the courses strong pedagogically while enabling the maximum amount of interaction between students and faculty. We will ensure our courses are of the highest quality by having them reviewed, critiqued, and contributed to by our academic advisory board of 6 professors and healthcare professionals knowledgeable about obesity care. We are also pursuing validation of our postgraduate certificate and diploma with the University of Chester, which is well known and has a growing reputation in dealing with chronic healthcare conditions. In addition to our postgraduate certificate and postgraduate diploma, we will be launching a massive open online course, or MOOC, later in February about the obesity problem. It is for a general audience, especially those who are suffering from the illness, their families, friends, who see its debilitating effects up close. It's also for professionals like yourselves who are involved with this problem every day. The unique structure of our MOOC will facilitate the start of a national conversation to a much wider audience, which will see the MOOC transformed into a massive online obesity conversation, the first of its kind in the world, that will enable us to gather a rich treasure of information about how obesity is affecting people's lives. I'd just like to quickly summarize by saying that we at the College of Contemporary Health are trying to build a 21st century educator focused on dealing with, at the postgraduate level, in chronic healthcare conditions like obesity, which we hope in the long run will make the UK healthcare profession the most obesity literate in the world, because ultimately it's only with a large number of people being highly trained that you'll be able to make any difference. So we'd like to thank you very much for your attention, and we're really proud to be a sponsor of this event, and we look forward to contributing again in the future. Thanks very much.